Good evening, everyone. Welcome to our live session. I'm Maitri, your host for tonight, and I'm thrilled to welcome Dr. Rajesh Taneja, a renowned expert in urology. Today, we are discussing a crucial men's health issue, prostate enlargement. Welcome, Dr. Taneja.
Thank you very much, Maitri, for giving me this opportunity to speak about men's health and in specific, the health of prostate in men. So I'm happy to be here.
Let's dive right in. Dr. Taneja, could you start by explaining what prostate enlargement is and how common it is?
Prostate is a walnut-sized organ situated underneath the urinary bladder of men, and through this organ the urinary passage passes, which is called urethra. So this gland starts changing its size by the fourth decade of life because of some changes in the hormone milieu of the men. And when it enlarges, it impinges upon the urinary passage called urethra, and then it disturbs the act of urination in men. It is quite common. In fact, if you look at if you were to do biopsy of men beyond 40 years of age, maybe by 80% of these men, they would show some what we call histological, that is the biopsy specimen showing changes suggestive of benign enlargement of prostate. But clinically, not all men who have this will present with symptoms.
Thank you for explaining, Dr. Taneja. What are the typical signs and symptoms that someone might experience if they have an enlarged prostate?
So generally, as the prostate enlarges, as I said, it is situated around the urinary passage. It impinges on the passage, making it narrow, making it more irritable. So these men would have obstruction during the passage of urine. They will feel that they need to wait for a long time before they finish the act of urination. The urine is not as a full stream, it is restricted stream, it is a broken stream, and at the end they have a sense of incomplete evacuation of bladder. They also have what is called frequent desire to pass urine and a sense of urgency, so that once they are going near the washroom, they would almost leak and they have to rush into the washroom before they soil their undergarments.
Appreciate the clarification. Dr. Taneja, are there certain age groups more prone to prostate enlargement, and if so, why?
The prostate starts enlarging, as I said, in the fourth decade of life, and generally the symptoms start appearing in sixth or seventh decades. Very few men would have it even before the sixth decade in life. They basically happen in men who are passing the middle age, and in those men, because of changes in the hormones, there would be a change in the prostate size and it will give rise to symptoms.
Thank you for providing insights into each factors. Dr. Taneja, how does an enlarged prostate affect a person's daily life and overall health?
When the prostate starts enlarging, it causes irritation in the urinary passage. So if you are sitting in a meeting, you need to rush to the washroom, you need to excuse yourself. You are watching a movie with your family, you can't watch it at a stretch, you will need to excuse yourself and go to the washroom. In very bad cases, men would spend more time in washroom than in bedroom at night. So these are sometimes very difficult situations, so that they cannot participate in their family functions. They cannot participate, they cannot go for picnics, they cannot go for shopping, and every time they go out, they first make sure that they have attempted to empty their bladders, and once they go outdoor, they try to locate the sign where they could find a washroom or a restroom so that they can empty or relieve themselves. So this is a huge problem for people who actually would be then scared to participate in group activities or family activities or go outdoors. Also, since they spend a lot of time in the restroom during the night, they are not fresh when they wake up in the morning, and that is huge because they would not be able to contribute to the normal activities of their or their duties that they are maybe assigned to, or the day-to-day work that they are supposed to be doing.
It's essential information, Dr. Taneja. Can you discuss the main causes of prostate enlargement? Are lifestyle factors a significant contributor?
Prostatic enlargement occurs in all men, but it does almost all men, but it does not give rise to symptoms in many. So, and it occurs because of changes in the hormones. So obviously, I don't think that there are any lifestyle changes which can bring about a change in the manner in which the prostate is going to trouble them. And also, it can be said that there are men who have genetically predisposed to being suffering from the enlarged prostate.
Thank you for detailing the causes. Dr. Taneja, how is prostate enlargement diagnosed? What kind of tests or examinations are typically involved?
Nowadays, we have very good tests for diagnosing enlargement of prostate. The best is, of course, we must start with symptoms. The urologist or the doctor should be able to talk to the patient, understand the symptoms, and then perhaps examine the patient. What you can do is, as a doctor, can tell you if the bladder is emptying well or not by putting a hand on the abdomen. Or a doctor can examine the prostate by putting in a finger through the rectum. Now, putting a finger in the rectum will tell you that yes, there is a prostatic enlargement, and it will in many situations pick up a nodule which could be cancerous. So history and physical examination remain the mainstay of evaluation by a urologist. And then, of course, one needs to get certain tests done. The basic test is a urine routine test, because if it shows infection, we get a urine culture and maybe we give antibiotics and the symptoms resolve. The others are, of course, you need to get an ultrasound which shows the size of the prostate, looks at whether the bladder is emptying or not, and is there any back pressure change to the kidney. That means, are the kidneys suffering because of an obstruction due to prostatic enlargement? Also, we should do what is called a prostate specific antigen. It is a blood test called PSA. PSA signifies infection as well as it will signify any malignancy that may be harbored in the prostate. So when we do a PSA test, we must tell the patient that look, this is what we are going to do. It may turn out to be a high PSA value for which we will need to investigate further. So don't be anxious. So routinely, most of the places when a person is approaching a doctor with an enlarged prostate, it becomes the responsibility of the urologist to at least do the PSA so that he should find or make a definitive pathway for treatment of these patients. For example, if the PSA is high, one will need to exclude cancer of prostate in these men. So the basic tests are history, examination, urine routine, ultrasound, and PSA. And in cases where we feel that we are not sure whether the urinary flow is bad or good, sometimes patients are not able to tell you very clearly, we should do a uroflowmetry. Uroflowmetry is a test in which the person is asked to pass urine in a computerized container, and then the graph is generated and that is interpreted by the urologist. And after seeing the graph, the urologist should be able to tell you that okay, your symptoms are due to enlargement of prostate causing obstruction, or they are due to a stricture urethra, which is entirely a different disease, or it may be something else. So uroflowmetry becomes essential before you start giving a surgical treatment to the patient.
Dr. Taneja, moving on to treatment options, what are the common approaches for managing this condition?
So when the prostate gets enlarged, it causes obstruction and irritation to the urinary passage. For obstruction, we give certain medications. Now in India, there is a tablet called Urimax. It is almost a household name. But then these are alpha blockers. Alpha blockers means they will that is called tamsulosin or alfuzosin or then silodosin. These are the molecules which act by relaxing the bladder neck and opening the prostatic area so that the flow improves. Then there is another class of drugs called dutasteride or finasteride, which are supposed to reduce the size of the prostate, and by that they will reduce the size they will cause opening up of the passage of the prostate, and that is how the urination becomes more comfortable. The bladder empties very well and it empties at a lower pressure. The person does not have to exert to pass urine. Once the medicines are given, there may be some more additional medicines required to reduce the frequency. So these are anticholinergic agents or beta-3 agonists. So these medicines will reduce the irritability of the bladder so that the person who is waking up at night maybe 6-7 times will reduce to maybe 2 times. So he will be a very happy person. But in cases where the bladder is not emptying well, or there is pressure on the kidneys going on, which is being transmitted from the non-emptying of the bladder or overfull bladder, then one has to make sure that the kidneys are safe. In such situations, surgical treatment must be advised to these men because they also have a chance of getting a total obstruction sometimes that may happen as an emergency and may require putting in a tube called catheter and attaching it to a urinary bag.
Thank you for outlining the approaches, Dr. Taneja. Are there any new or emerging treatments for prostate enlargement that show promise?
Yes, so we have had surgery for the prostate, and there was a good old time half a century ago where we used to open up through an incision and put in a finger and remove the prostate and put a tube, but that is called open surgery. That is very rarely required these days. Then maybe since 1960s we started having what is called TURP, where we needed to put in a telescope through the urinary passage and we used to scrape off the obstructing prostate and we would just put in a catheter and the patient would improve. So for the last maybe quarter of a century we have been having lasers, and some of the lasers like holmium laser has stood the test of time, and we have been doing holmium laser enucleation of prostate very regularly. It is a very promising technique in the sense that there is hardly any bleeding, the patient recovers faster, patient can be discharged faster, and patient can resume his daily activities much earlier as compared to open or TURP.
Exciting developments. Thank you for sharing, Dr. Taneja. Doctor, can lifestyle changes or home remedies be effective in managing symptoms of an enlarged prostate?
Lifestyle changes are difficult to comment, yes, but there is a system where in Indian villages patients used to squat and pass urine. That way they would open their pelvic floor and the flow would be much better. So standing and passing urine may be difficult for certain men, and they learn that if they squat and pass urine, their urinary flow improves. So that is one part that I can tell you. Regarding home remedies, it is these are not standardized. There are certain things which are advertised as they will help, but certainly it is not scientific to use things which have not been proven scientifically. So, for example, I would suggest that you should not risk your life. You should not be experimenting on yourself. You should allow others to experiment, generate scientific evidence, and use that scientific evidence rather than experimenting on yourself. So I know there may be certain proponents of home remedies for enlarged prostate, but I would be skeptical and I would not use it on myself.
Valuable insights on lifestyle changes. Dr. Taneja, what advice would you give to someone who suspects they might have an enlarged prostate?
See, the first thing is that prostatic enlargement rarely manifests itself before 55 years of age. It's rare. It's not that it doesn't, it can, but it is rare. So beyond 55 years of age, if you start having urinary symptoms, you should consult your doctor, get an ultrasound done, get a urine test done, and maybe a uroflowmetry, and then a urologist can decide whether to put you on medication or do something else.
Thank you for the advice, Dr. Taneja. Finally, how important is regular screening and checkup for prostate health, and at what age should it begin?
Prostate is very important for men's health. So prostate can have either a benign enlargement that we have just talked about, or it can have a cancerous development. So therefore, if you have symptoms which are pertaining to urinary system and you are beyond 50 years of age, you should not ignore them, because the symptoms of benign enlargement are almost as same as the malignancy in the prostate. Sometimes, malignancy in the prostate will go unnoticed. As in early cases, there may not be any symptoms. But if the symptoms arise, one has to differentiate whether we are dealing with a benign prostatic enlargement or a malignant enlargement. Therefore, it is essential that if somebody beyond the age of 50 develops urinary symptoms, he should approach the nearest urologist, get himself checked up, and maybe he will be benefited or rewarded for it. Also, if you don't have any symptoms, then the best is that beyond 50 years of age, you may choose to get a test called PSA every year and make sure that it is stable and doesn't have too much rise anytime. If you have a person in your family, maybe your father, grandfather, paternal uncle, elder brother, elder cousin, who has had cancer of prostate, or your mother or sister who have had cancer of breast or cancer of colon, cancer of pancreas, then perhaps you should start having an early checkup for your PSA or a prostate specific antigen starting from the age of 45 years. Because if you have a genetic makeup which predisposes you to the prostate cancer, then the earlier the better. You must find it out before it announces itself. So nip the evil in the bud. So therefore, you must start screening at 45 years and up if you have a family history of cancers.
Thank you, Dr. Taneja, for this insightful discussion. It's been extremely informative. And thank you to our audience for joining us. Until next time, stay healthy and informed.
Thank you very much, Maitri.